Shoulder replacement surgery is a medical procedure that relieves pain and restores mobility in a damaged shoulder joint. The surgery involves replacing the damaged parts of the shoulder with artificial components called prostheses. These prostheses are designed to mimic the natural shape and movement of the shoulder joint. This procedure is typically recommended for individuals suffering from severe shoulder pain and limited mobility due to conditions like osteoarthritis, rheumatoid arthritis, or severe fractures. It is important to consult with a qualified orthopedic surgeon to determine if shoulder replacement surgery is the right option for you. Shoulder replacement surgery is a safe and effective procedure that can significantly improve the quality of life for individuals with debilitating shoulder conditions. With advancements in medical technology and surgical techniques, patients can expect a faster recovery and improved long-term outcomes. Shoulder replacement surgery is not for everyone. It is typically recommended for patients who experience severe shoulder pain and limited range of motion that significantly impacts their daily activities. Conditions like osteoarthritis, a degenerative joint disease that causes wear and tear of the cartilage, are common reasons for shoulder replacement. Other conditions include rheumatoid arthritis, an autoimmune disease that causes inflammation of the joints, and traumatic injuries like fractures. Conservative treatments, such as medication, physical therapy, and injections, are usually the first line of treatment. However, when these treatments fail to provide adequate relief and the pain and stiffness interfere with daily activities like dressing, bathing, and sleeping, shoulder replacement surgery becomes a viable option. Shoulder replacement surgery is performed under general anesthesia, meaning the patient is asleep during the procedure. The surgeon makes an incision over the shoulder joint to access the damaged bone and cartilage. The damaged ball at the top of the humerus, or upper arm bone, is then removed and replaced with a metal ball attached to a stem. The socket in the shoulder blade, called the glenoid, is also prepared, and a plastic socket is implanted. In some cases, only the ball of the shoulder joint is replaced, known as a partial shoulder replacement. This procedure is an option for patients with damage limited to the ball of the joint. After surgery, patients typically stay in the hospital for a few days. Pain management is crucial in the initial days after surgery, and a combination of medications and other pain relief methods is used. A rehabilitation program is crucial for a successful recovery. Patients start with gentle exercises to regain range of motion and gradually progress to strengthening exercises as they heal. The recovery process varies depending on the individual and the type of surgery performed. Most patients can expect to return to most of their daily activities within 3 to 6 months. Section 5. The benefits of a new shoulder. Shoulder replacement surgery can significantly improve quality of life for individuals suffering from debilitating shoulder conditions. By replacing the damaged joint, the surgery aims to relieve pain. One of the most significant benefits is the reduction or elimination of pain, allowing patients to engage in activities they once enjoyed without discomfort. It also aims to improve mobility. The surgery restores range of motion, enabling patients to perform daily tasks like dressing, bathing, and reaching overhead with ease. Additionally, the surgery enhances strength. As patients progress through rehabilitation, they regain strength in their shoulder, allowing them to participate in more physically demanding activities. Lastly, it improves sleep. Many patients report improved sleep quality after surgery, as they no longer experience pain that disrupts their rest. Section 6. Shoulder replacement in India, a beacon of hope. India has emerged as a leading destination for high-quality and affordable healthcare, attracting patients from all corners of the globe. Shoulder replacement surgery, in particular, has witnessed significant advancements in India, with hospitals offering cutting-edge technology and experienced surgeons. The cost of shoulder replacement surgery in India is significantly lower compared to developed countries, making it an attractive option for patients seeking cost-effective treatment without compromising on quality. Moreover, India boasts a vast pool of highly skilled orthopedic surgeons specializing in shoulder replacement surgery. These surgeons are trained at renowned institutions worldwide and possess extensive experience in performing complex procedures with high success rates. Section 7. Choosing the right hospital, factors to consider. Selecting the right hospital for shoulder replacement surgery is crucial for a successful outcome. When considering hospitals in India, it's essential to factor in accreditation. Look for hospitals accredited by reputable international organizations like JCI, Joint Commission International or NABH, National Accreditation Board for Hospitals and Healthcare Providers, which ensures adherence to stringent quality and safety standards. Surgeon's expertise. Research the surgeon's qualifications, experience, and specialization in shoulder replacement surgery. Look for surgeons with a proven track record of successful outcomes. Technology and infrastructure. Choose hospitals equipped with state-of-the-art technology and infrastructure, including advanced operating rooms and rehabilitation facilities. Patient testimonials. Read online reviews and testimonials from previous patients to get insights into their experiences with the hospital and the surgical team. MedWorldIndia, your partner in healthcare. Navigating the healthcare landscape, especially in a foreign country, can be overwhelming. MedWorldIndia is here to simplify your medical journey. As a leading medical tourism facilitator, MedWorldIndia connects patients from around the world with top hospitals and surgeons in India for a seamless and hassle-free experience. Our team of experienced medical professionals provides personalized assistance with every step of your journey, from choosing the right hospital and surgeon to visa assistance, travel arrangements, and post-operative care. Contact MedWorldIndia today for a free consultation and let us help you take the first step towards a healthier and more active life.